Hello, my name is Jennifer Cooper and I am a DNP student at UAMS. Today I am presenting my review of a research article by Lever et al. 2024 titled Real-Time Continuous Glucose Monitoring in High-Risk People with Insulin Requiring Type 2 Diabetes, a randomized controlled trial. Briefly, the authors explain that high-risk patients with insulin-requiring type 2 diabetes face challenges with traditional self-monitoring of blood glucose. Real-time continuous glucose monitoring, or RTCGM, provides instant data for better glycemic management. Historically, RTCGM has improved glycemic control among individuals with type 1 diabetes and among type 2 diabetes requiring insulin. However, there were no randomized controlled trial studies involving RTCGM among people with type 2 diabetes who self-titrate their insulin according to titration algorithms. Therefore, the purpose of the study was to assess whether RTCGM improves glycemic control and reduces risk among individuals with insulin-dependent type 2 diabetes better when compared to traditional blood glucose monitoring. Hopping over to the methods, this was a multi-center randomized control trial among clinical settings involving 67 participants who were randomized into the intervention and control groups. These participants had to be over 16 years of age with type 2 diabetes, a hemoglobin A1C over 8%, and having administered at least 0.2 units of insulin per kilogram per day for 3 months. Baseline data was obtained over 2 weeks via a blinded CGM. During this phase, a diabetes nurse specialist, under the supervision of an endocrinologist, optimized their cardiovascular and non-insulin glucose-lowering medications. Participants were then randomized into the interventional group using the Dexcom G6 RTCGM system with a smartphone app, or to the control group using the CareSense glucometer with Bluetooth capacity and smart log software. Data from both groups was then collected over 12 weeks. Data analysis included constrained longitudinal analysis and linear mixed effects models, among others. In reviewing the results, RTCGM significantly improved all measures of glycemic control and reduced hypoglycemia compared to traditional monitoring, as you can see in the chart and graph below. The authors conclude that evidence strongly supports RTCGM as an effective solution for improved management of insulin-requiring type 2 diabetes. In nursing practice, this evidence suggests that RTCGM could replace traditional blood glucose monitoring to improve diabetes care, and implementation into routine care should be considered to improve patient outcomes. My references are included in the lower right corner for the information I provided. Thank you so much for your time and attention during this presentation.